We're here with GU Oncology now, and I have the pleasure of talking with Dr. Yair Lotan about some projects that he's doing here at the AUA. And I saw one about using AI as a predictive measure of BCG responsive and non-muscle invasive bladder cancer. So will you tell me about that?
Sure. So I think we all recognize that patients with high-risk disease come with heterogeneity. There's differences in terms of the risk for a TA tumor versus a T1 versus CIS, tumor size, multifocality. These all play a role. And people have developed risk stratification tools, whether or not it's the EORTC tools or Cueto, even the EA guidelines have some recognized tools, but yet they sometimes don't give you an accurate representation of recurrence and progression. And there's only so much you can do maybe with clinical data. Mm-hmm. So the goal of this study was to see whether or not we could use pathology slides and an AI algorithm to try to improve prediction of recurrence and progression in patients who were BCG naive, received BCG. Sure. And so what we did was we assembled a 12-center cohort of about 950 patients. We got two slides, representative slides from the tumor. We collected clinical data, and then we followed the patients. So we used about a third of the patients for testing, and then 2/3 of the patients, so over 600 patients for validation. And what we found was that for recurrence, when you look at high-risk patients, focality was an independent predictor. And then for progression, not surprisingly, T1 patients did worse. But when you added the AI algorithm based on a variety of pathologic features, you found that you could independently improve prediction of recurrence by 2-fold and progression by 3-fold. This is on top of all the independent risk factors. And when we took the same cohort of over 900 patients and applied the EORTC criteria and the EAU criteria for recurrence and progression respectively, the AI algorithm actually performed better than either of these risk stratifications. I think this has clinical implications. First of all, having an H&E slide is what everybody has. Other genetic tests require sufficient tissue. There's an expense to doing this processing. There's a time component. And so if you can use just an H&E slide and get some additional independent information, not only can help you inform the patient in terms of their prognosis, but we also know that there are some trials looking at combination therapies. Mm-hmm. Those trials will show that maybe some patients will benefit, but there's going to be additional cost and toxicity. So why don't we use those types of therapies for the highest risk Sure. patients, and then maybe just BCG for the ones that don't need it. And I think it's also important to be able to have a conversation with a patient who might have worse disease early on about should you have cystectomy. Most patients don't want to hear about it, but I think the sooner you enter that conversation, especially if we have more information for them, the better it will be for them to try to make that decision.
Sure. Yeah, I think this is, great tool of working towards intensifying and de-intensifying therapy for non-muscle invasive bladder cancer patients, right? And we try to do that clinically, as you noted, but we're not very good at it, and our tools up to this point haven't allowed us, to really look at that intensification or de-intensification for patients. So that's exciting.
Yeah. So there's a early access program with 10 institutions, and there's a multi-center prospective study that's underway. And so I think we'll get more information, but the nice thing about these AI algorithms is the more information you feed them, the better they tend to get. And so we think of facial recognition programs, but here we have tissue, and this tissue recognition type program is going to, I think help our patients and Sure. us try to make the best decisions.
Yeah. So you're just going to continue teaching this AI, right, to output better and better data.
Yeah, for future permutations, might be able to allow staining or molecular data Sure. on top of this, what is currently just an H&E slide.
Great. All right. Thank you so much for being here.